Thank you, everyone, for taking time out of your busy schedule to attend this webinar. These are important things we're discussing here. If you're in this meeting, more than likely you are a Medicare eligible beneficiary, or you will be becoming eligible for Medicare soon. So this is good information for you. As you know, this is our annual election period, annual enrollment period. Let me back up here. Every year from October 15th through December 7th is the time of year where Medicare eligible beneficiaries can change from one Medicare Advantage plan to another and make all sorts of changes that are going to take effect January 1st of 2021. So Clever Care Health Plan is one of the options that Medicare eligibles have to choose from. Currently in LA and Orange County, there's over 55 different plans that Medicare eligibles can choose from. And sometimes it can be a daunting task trying to figure out which plan is the best fit for me. So what I'm going to do is I'm going to briefly talk about Clever Care and go over their benefits and help you understand why we feel that Clever Care is a really good fit for any Medicare eligible senior. So Clever Care Health Plan is a brand new company, and our plan is being offered for the very first time, January 1st of 2021. However, although we are a brand new company, we are being led by a very experienced team. Our senior management is being led by our CEO, Dave Firdaus, and he's actually one of the founders of Clever Care Health Plan. We got 3 founders. And prior to joining Clever Care, Dave served as CEO for Blue Cross and Blue Shield of Arizona for about 5 years, where he led revenue growth from 230 million to 660 million. So he also served as the Chief Operating Officer of Scan Health Plan of Arizona. Along with Dave and our senior management team, we have Myung Lee and another founder. And Myung has about 13 years experience in the healthcare leadership. He has a proven track record, and prior to helping found Clever Care, Myung was instrumental in building Clover Health's provider network and overseeing operations. He also served as Chief Operating Officer of Satellite Health Plan and CFO and COO of Inspira Health. Finally, rounding out our senior management team, we have Myung Hiep Pham. Hiep is also the third founder of Clever Care, and Hiep has extensive experience in healthcare finance spanning over 14 years. So prior to Clever Care, Hiep served as CFO of Blue Cross and Blue Shield of Arizona as well. And that's our senior management team. Now, some people may ask, well, how financially strong are you? Clever Care is backed by Northwest Venture Partners, and this is a wholly owned subsidiary of Wells Fargo. So a lot of people may not be familiar with Northwest. However, they're very familiar with Wells Fargo, and again, a wholly owned subsidiary of Wells Fargo. Okay. So our mission is to help improve the health of our members by delivering access to culturally sensitive healthcare solutions. And what do we mean by that? So healthcare decisions, we feel, are a very personal decision, and they're a lot of times they're driven by cultures and values. So that's why we want to offer our Medicare beneficiaries options that are sensitive to the way different communities access care. In addition to our comprehensive health plans, we provide our members with in-language support services in order to help improve their access to care and help. So you can actually call Clever Care and speak to someone not only in English, in Spanish, but also in Korean, Vietnamese, Mandarin, Cantonese, and I'm missing one. But yeah, we have our dedicated representative online, so there's no interpreters needed. You can speak to someone in your own language, which is always a nice thing to do. Okay, so what we're doing here is we kind of call this East meets West. So what we're doing is we're offering Eastern medicine benefit that combines centuries-old alternative therapies that focus on managing stress and returning the body to its natural balance, along with the Western medicine of extensive networks and doctors and hospitals, which focus on treating illnesses which are crucial for long-term care conditions. So we are offering a balance of these, and that's why we're calling it East meets West. So our Eastern medicine benefit uh, focuses on balance, interconnectivity, and proactivity. So Eastern medicine is a 2,000-year-old medical system, and Eastern medicine, also known as traditional Chinese medicine, is derived from the theory that the qi, or the life force, flows through our body. And when that qi is compromised, the body is susceptible to disease. Natural treatment methods such as acupuncture, herbal remedies, and cupping can be used. Additionally, energy balancing exercise supports the well-being of the mind and body. So again, we talked briefly about acupuncture, but there's also other forms. There's electroacupuncture, which is a type of acupuncture using electric stimulation to help patients manage pain. Cupping is a technique in which a glass, hang on, let me move my little, okay. It's a technique which uses a glass or plastic cups, and they're placed on the body. A lot of people became familiar with this. I don't know if those of you remember the Olympics when Michael Phelps appeared out of the water. He had all these little round marks on his back, and people were like, well, what was that? Well, that was cupping, right? So it helps with joint pain, back and neck pain, arthritis, abscess, facial paralysis. Those are just some of the techniques that cupping can help with. MedX treatment is a brand of advanced rehabilitative equipment designed specifically for the isolation and treatment of chronic back pain and dysfunction. So it focuses on increasing strength, decreasing pressure on the spine and nerve roots, and ultimately decreasing pain. Tui Na is a Chinese massage method that has been shown to increase muscle strength, flexibility, balance, and aerobic conditioning. Gua Sha massage and reflexology. Again, these are other forms of Eastern medicine treatments that help people who use these treatments to get better sleep, reduce their stress, and the practice of relaxation. Infrared therapy is a process of placing heating pads on the body to increase blood flow, which treats cardiovascular, autoimmune, and other chronic health problems. And then herbal supplements. Herbal supplements have shown effects in promoting anti-inflammation, antioxidation, and natural cleaning process of the body. So these are some of the benefits that we're introducing and are available as a Clever Care member. These are some of the examples of some of the herbal supplements that are covered. However, this is just a little snapshot. We have lots and lots of Chinese herbal supplements that are covered under this plan. So what I'm going to do now is, right now, this plan talks about our Medicare. This slide here talks about our Medicare Advantage plan. So this is a Medicare Advantage plan, which covers all of your Part A benefits, which are your hospital benefits, and also your Part B, which is all of your outpatient services and medical services items. This plan also covers your prescription drug coverage. In addition to your medical benefits, these are benefits that Medicare doesn't cover: dental, vision, and hearing. And under this plan, those benefits are definitely covered. Our Clever Fit benefit is, instead of a gym membership, we offer in-person Tai Chi classes or on-demand video. So you're welcome to come join us in person. However, if you feel uncomfortable coming out in public and being around other seniors, we offer these classes on demand. You can just go to our clevercarehealthplan.com website and play the videos when it's convenient for you and in the comfort of your own home. Acupuncture, this is the big one here. We offer unlimited acupuncture visits. So this is a benefit that you do not need a referral. And you can go every single day if you find an acupuncturist that's open on Sundays too, right? But this is an unlimited benefit. So zero copayment, no referral. So that's amazing. And then we talked about the natural herbal supplements, and we give you an allowance, and I'm going to go over those benefits, the allowances in a moment. And then the Eastern Wellness Services that we talked about briefly, the cupping, the moxa, the Tui Na, Gua Sha, all those things. And And then our COVID-19 coverage, because COVID is a big concern for everybody, especially the seniors who are our most vulnerable population, right? So we want you to rest assured and have COVID peace of mind. If you are ever diagnosed with COVID, anything related with that COVID diagnosis is going to be covered 100% zero out-of-pocket cost to our members. In addition to the natural herbal supplement allowance that we're going to be talking about in a few minutes, we also offer you an over-the-counter benefit. So these are to purchase those other items that you would find typically in a pharmacy, you know, aspirin, cough syrup, those sort of things. We provide you an allowance to get those items. And then we also have a member reward and incentive program to reward our members for doing the things that they should be doing anyways. For example, completing an annual physical, right? Or completing your Medicare annual health risk assessment. So those are just some of the benefits covered under our Medicare Advantage plans. And at the bottom of the slide, it talks about where we are. So Clever Care, our Medicare Advantage plans are available in Los Angeles, Orange, and San Diego counties. Okay, so let me switch slides here for a second here. Toya, I'm not sure if you're still on the call or not, or on the webinar, but can you see my new screen here?
Yes, it says Clever Care 2021 MAPD plans.
It should say Clever Care Longevity Medicare Advantage HMO benefit plan. 375.
No, we don't see that
okay.
slide.
Let me do this here then. Screen share. Screen share. New share. How about now?
Okay, there it is. I see Clever Care Longevity Medicare Advantage.
That's it. Okay.
Perfect.
So thank you. Okay, so everyone, Clever Care offers 2 Medicare Advantage plans. One of them is called our Clever Care Longevity Medicare Advantage plan, and the other one is called our Clever Care Balanced Medicare Advantage plan. Now, as a Medicare eligible, you are eligible to enroll in either of the 2 plans. However, depending upon the type of coverage you have, one plan is going to provide you a higher level of benefits. So for example, this particular plan here is our Longevity Medicare plan, and this is designed for Medicare eligibles who have only Medicare coverage. They do not have any Medi-Cal or any other sort of coverage. But this is a brief overview. So as you can see, the acupuncture, Eastern wellness therapies, those 12 visits, massage therapies, the Twina, the cupping, you get 12 of those per year at a 0 copayment. The Chinese herbal supplement allowance is $45 per quarter. So you will be able to spend $45 every 3 months on Chinese herbal supplements. If you do not use your allowance, it rolls over into the next quarter. So technically, if you don't use this benefit, by October 1st, you will have $180 available to spend on Chinese herbal supplements. This plan also covers dental, as I mentioned earlier. And what's great about this plan, this is not your typical HMO dental plan. First of all, we cover your exam and x-rays every 6 months at a 0 copayment. And then after that, we provide you with an allowance, $375 to spend every 3 months. So it kind of works a little bit like the herbal supplement, where if you don't use your $375 allowance January, February, March, April 1st is going to roll over, and now you're going to have a total of $750 in your dental bank account there. And then again, if you don't use your benefits by October 1st, you're going to have a total of $1,500 to spend on dental services. Now, what's very amazing about this dental plan is that this is a comprehensive dental plan, which means we don't tell you that, no, this is not covered, this is not covered. you can spend that money on any dental procedure that you want. If you want to spend it all on a dental implant, you can, which is pretty much unheard of because most of those dental benefits are typically not covered and restricted or limited by other dental plans. So on top of the dental plan, the amazing dental plan that we have, we also offer a vision benefit that covers an eye exam and an allowance of $300 every 2 years. So if you want to get those designer Gucci frame lenses, frames for your glasses, you got $300 to spend on those. Also, hearing aid benefit. So there's a zero copayment for the hearing aid exam. And then we cover $500 per ear every year. Okay, so that's a total of $1,000 in hearing aid allowance. And then the over-the-counter item allowance that I mentioned earlier, where you can buy other things that you find in your normal pharmacies like Band-Aids, cough syrup, those sort of things. We provide you a $60 per quarter allowance. So again, every 3 months, you'll get $60. By October 1st, you will have $240 in your over-the-counter allowance benefit to spend. However, these allowances do expire on December 31st, so you have to use them by the last day of the year in order to be able to claim them, okay? And on top of that, you can see here our office visits to our primary care physicians. It's a zero copayment. Specialist visits, it's a zero copayment. Preventive screenings, it's a zero copayment. Lab services, zero. Basic x-rays, diagnostics, zero. Urgent care, if you ever need to be seen immediately, we have a $25 copayment for urgent care. And we also have a $100 copayment for emergency care. Now, a lot of people don't realize it, but Medicare does not cover you when you're outside of the country, even in an emergency care situation. However, our Clever Care longevity plan does cover you outside of the country. You're covered worldwide for emergencies. You would just simply pay for the services when you're outside of the country and bring all your receipts back, submit them to Clever Care. We're going to reimburse you 100% less your $100 copayment. Okay, and that is limited to $25,000 in bills per year. Okay, then finally, the ambulance copayment is a $225 copayment. Right, so inpatient hospital, we got a $90 copayment for days 1 through 5. And then let's jump down to prescription drugs. Our tier 1, which is our preferred generics, are covered at a zero copayment. If it's a non-preferred generic, then it's a $5 copayment. Your preferred brand, tier 3, is a $35 copayment. Your tier 4, which is non-preferred brands, are covered at a $75 copayment. Okay. So this is, again, this plan here is designed for those individuals who have Medicare only. This will provide you a higher level of benefits. Now, let me tell you, can you see the new one that I put up there?
Let's see. This one says Clever Care Balance Medicare Advantage.
Perfect.
Okay.
Perfect, exactly.
Perfect.
Okay, so this is the other Medicare Advantage plan that Clever Care offers. And again, as a Medicare eligible, you're able to enroll in either plan. However, if you have Medicare and Medi-Cal, this is the plan that I would recommend for you. So the benefits are almost identical, except you're going to have zero out-of-pocket costs. There are some slight differences in the allowance. If you can see here, my pointer over here, the herbal supplement allowance, instead of $45 per quarter, you get $50 per quarter on the balance plan. For the dental over here, instead of $375 per quarter, you get $400 per quarter. The eyeglass benefit is the same. However, the hearing aid benefit is a lot richer on this plan. And again, this plan is designed for people who have Medicare and Medi-Cal. But the hearing aid allowance is a $1,500 benefit per year, okay? And then your over-the-counter allowance is $45. And you're going to see a lot of percentages over here. But remember, this is a plan for people of Medicare and Medi-Cal. So wherever you see these out-of-pocket costs, 20%, $20, $90, those are actually picked up by Medi-Cal. So technically, it's covered 100%. So we're covering the 80%, and then Medi-Cal is covering the other 20%. So those are basically the differences between the two plans. And again, we only have until December 7th to make a decision. If you're interested in finding out more about Clever Care and enrolling into the plan, I'll be happy to talk to you. I'm going to be here available. Actually, this afternoon, one of my associates is going to be manning our booth. Joyce Ty will be there to answer any questions. However, my contact information is at our booth. If you're interested in either having a meeting, either like this on a webinar, I can set that up. If you'd like me to come meet you at your home, I'd definitely be able to do that as well. If you want to meet somewhere by your home at a coffee place, we can do that. We want to just make sure that you're comfortable meeting with us and helping you understand how we feel that this plan is a really, really good fit for you. So, okay, I think that covers my presentation. So if we want to open it up for questions, Toya, that would be great.
Yes, absolutely. Let me show. There we go. Hi, everyone. If I see that Joyce has been writing some notes there in the chat box. So I don't know if you had any questions for Pete. He would be happy to answer those questions. Joyce will again be available in her virtual booth after this presentation, and again tomorrow, I believe. Any questions? And if you're not comfortable unmuting yourself, you can type your question in the chat box. Okay, well, if we don't have any questions, we will end this presentation. And thank you so much, Pete, for taking time out of your day to provide us with some really great information about the Clever Care Health Plan. And again, if you have any questions, feel free to reach out to the Clever Care Health Plan virtual booth, and Joyce Ty will be able to assist you.
Thank you, Toya. Thank you, everyone, for attending. And it was a pleasure to be here, and look forward to the rest of the day.
Great. Thank you all, and hope to see you in some additional sessions later this afternoon. Have a great day.
Thank you, everyone. You as
Bye-bye.
well. Happy Friday.
Happy
Thank
Friday.
you. Bye-bye.
All righty.